Can you hear me? Lecturer and researcher, Kabarak University, Kenya, Dr. Awinda Otieno. Can you give us your opinion? Dr. Byakatonda.
Hello, everyone.
Yes.
Allow me to give my opinion in the next 30 seconds.
Okay, can you give your opinion, please?
Hello, my name is James Kipkorir Tanu. I'm a founder, I'm a Kenyan founder, Green Minds Network, and also youth environmental activist. I'm truly honored to join this important conversation to share this space with such distinguished speakers and climate actors from across East Africa. I want to sincerely thank the organizers for bringing up us together to reflect on how the new...
Other than Madam Susan, who do we have there? Agatha Namirembe Mama. Can you hear us?
Yes, I can hear you. Good evening, everyone.
Yeah, ma'am, you have 5 minutes, ma'am.
Good evening. I had connection issues. It seems I was trying to connect and I was not being let in. I've just been let in just now. So really, I've not been part of the discussion. However, I want to just make a few comments on this convention, the ILO Convention on Biological Hazards, which came in into 1990. It came this year, actually, in June. And for me, I view it as a very good convention, because I've heard the comments of Susan, which has come in to prevent the workers from getting infected while at work. And I want to relate it to the issues of the pandemic, especially the one we had of COVID-19. And that's why one of the reasons why that convention even was thought about, because we find that it was not covering the other conventions that we have on occupational health and safety. We are leaving out the biological hazards, some of them that can be made by man, others are generated in the kind of nature of work that we have, and others are inherent in the nature of work and the substances that we use in the workplace. But key for me to note is that first and foremost, plant materials and also animal materials are also put under that convention. We have been having a problem of where do you address issues like dog bites. When you are working, who compensates? And there was no clear line there, because such conventions were not in place. Find it as a simple thing, but it's a very hazardous thing, especially for staff who go out there and are working in the field. Even when you go out in the field, you can encounter poisonous plants and so on. And also, another thing that this convention covers, control and also preventing it, and also it has the responsibilities of training. It's an element of training and sensitizing workers on what to do and giving them protectives. So all that is covered. The workers also have responsibility that in case there is any dangerous work that is they are being asked to do, they can actually refuse to go into any dangerous situation. That's something that we see. When we look at the COVID part, we find that emergency workers were not even covered in any of these other conventions. But this one now covers emergency situations. Emergency that you can be called upon anytime.
Thank you so much.
So you're telling me my time is up. It's okay. Thank you.
You're welcome. We have Danice Otieno, Awinda. Yes, Danice.
Yes, good evening.
Can you hear us?
Yes, I can hear you. Can you hear me?
Yes, yes. You are the lecturer and researcher at Kabarak University, Kenya.
Yes, yes.
You are most welcome, and may we have your view?
Thank you very much. I've just joined. Sorry for joining late. There was an issue with the network,
Yeah, you
but
have
I've just.
5 minutes so that the other brothers and sisters can also give their view.
Okay, thank you very much. I just
You're
want to highlight a few areas on the International Labour Organizations, which is a global authority on labor standards. And we are saying that workplaces today has faced a lot of risks and biological hazards ranging from bacteria, viruses, fungi, and other pathogens, which pose significant threats to workers' health. These health workers, who include laboratory personnel, agricultural workers, we have waste handlers, and also people working in the offices, usually are exposed to these hazards at varying degrees. And the example here, talk about COVID-19. I've just heard about COVID-19 from the former speaker. For example, highlighted how quickly these biological risks could even could uh, could affect people or workers, but also entire economies, because it's not only the health workers were affected, but even the entire economies were also affected. So that the ILO's latest conventions and recommendations provide a structured approaches to prevent and manage and also mitigate some of these risks. And we're talking about key provisions within the ILO's mandate, which includes risk identification and assessment, where employers are required to systematically identify biological hazards and also assess the level of risks to the employees. I think that's very important, that we need to identify these risks and also do an assessment. As we do assessment, we'll be able to come up with how to fight some of these risks. We talk about preventive measures, which include implementation of engineering controls. We have safe work procedures, personal protective equipment. We saw this one's being given during COVID, and vaccination programs where possible. So we also have training and awareness, which is very, very important, where workers must be educated in biological hazards, transmission modes, and protective measures. And this was found within the ILO's latest conventions and also recommendations on how to protect the workers. We talk about reporting and response systems, enabling mechanisms for reporting exposures, and also we talk about response promptly to some of these incidents. Okay. Now, do we have implications of this globally and also regionally? The adoption of these conventions on biological hazards has more than regulatory compliance. It is a commitment to worker health. We talk about economic resilience and also sustainable development. And therefore, proper implementation of these recommendations will reduce workplace infections. We talk about boosting productivity. We talk about it also fosters trust between workers, employers, and also governments.
Thank you so
So
much, Dr. Danice.
thank you very much. So that is what I have to say, and therefore let us embrace all this. Thank you very much.
I believe other brothers and sisters might be having difficulties. Among those who have not yet spoken, do we have someone who is hearing us?
Yes, of course.
Yes, please.
Yeah,
May you
we are
give your
hearing.
opinion? Okay.
Yeah, we are hearing.
Yes. Can we have you please give us your name?
Uh, my name is it is written there in it Victor Ndege. I think you can see it.
Victor, please. Yes, I have seen. Can you give us your opinion?
Yeah, so concerning the webinar of today, I think we have gained a lot as the environmental students at Kabarak University. I think we are here, and some of us maybe they're having the internet issue, but we have gained a lot.
Yeah, there is a lot of
the,
internet connection problem, and after you, we are going to
yeah,
have Brother Anthony Macau after Victor Ndege.
that maybe I think they keep certain standards for labor rights and favorable working conditions. Concerning I think it is a convention that it was held globally to put into consideration concerning the rights of the workers and their working conditions. So in short, it is all about labor rights. So personally, I've gained more concerning the freedom and protection of rights of the laborers when they are in the company they are working. So they should be in a good, conducive, and maybe a clean environment that facilitate their well-being when they are taking the daily courses in their workstations. Another thing is the right to organize and collect bargaining agreement. Maybe whenever people are working somewhere and maybe something is not right concerning the discrimination, I think laborers can come together and maybe organize and uh, put something together for themselves. And thirdly, whatever I've also gained is something concerning the discrimination, maybe that might come as a result of employment or occupation they are undertaking in the working area. So the International Labour Organization, I think it tries, according to whatever I've heard, it tries to prohibit the discrimination of the workers during their employment. So it's concerning even the safety, their safety. Yeah, it prohibits the unconduciveness of the environment wherever people are working in one company or the other. So I've gained a lot, and I'm happy to be in this meeting.
Thank you
So I'm
so
glad.
much, Brother Victor Ndenge. May we hear from Brother Anthony Macau, and I beg the rest of the brothers to be patient with us because I was given the moderation late around 8:40. So I intend to extend this conversation until around 9:40. So those who are present, we will all have opportunity to give our opinion. Those who are already out of time, I beseech you to forgive us for starting late, but may we hear from Brother Anthony Macau.
It's okay. Uh, Protection against biological hazard is a key to safe and healthy working environment. According to International Labour Organization that has been adopted the first ever convention and the recommendation on the biological hazards, it is creating a global framework for the workers protection against risk like viruses, by other microorganisms and things. This is to implement the protective measures and providing training, while the recommendation gives detailed guidance on risk assessment, early warning system, and emergency response. So, therefore, it requires national policies whereby it include protection, prevention, and protection against biological hazard in the workplace. Also, it demands employer action whereby employers are required to take protective and preventive measures such as risk assessment, using PPIs, and conducting health surveillance. It also requires promote collaboration between the workers and representative on safety measures and ensure workers are informed and trained on the hazard and the work. It also encourages special protection. The convention acknowledges that certain groups may require special protection, such as women, hard workers, and those with pre-existing medical of R209. It provides on accompanying recommendation offers specific practical guidance for implementing the convention. It also requires elaborate on risk assessment. It includes detailed guidance on how to conduct risk assessment, identify exposure routes such as inhalation and injection, and also manage biological hazard. Last but not least, it defines biological hazard. It further elaborates on the definition of biological hazard, including microorganisms, allergens, and toxin of various organs. Thank you so much for the time.
Thank you so much. May we have the TEAMEnvironment Kenya, please?
Yeah, thank you so much. This is Ochanda, Mathew, the Executive Director, TEAMEnvironment Kenya. Glad for this opportunity. Mine just is to reiterate and echo what my colleagues have spoken, but I think next time, I appreciate that we started late. Next time, let's create an open link, and for the moderator, kindly give the speakers that had been scheduled to speak and to make their presentation adequate time, because I realized Dr. Awinda was adequately prepared, and we needed to leverage on the expertise that he shares so that we can feed in the conversation and other speakers as well, even as we appreciate the contribution of the other listeners, which is very, very valuable. So mine will be precise, just to saying that in Kenya, biological dangers have been exposed to many employees, and I'll pick one example. I don't know, but I know Uganda, you really have worked on your farms, most of your crop production to ensure that your food secure has been harnessed, has been protected against every form of intrusion. Unlike Kenya, the other day we had a very heated debate about the seed from farmers. So farmers were and communities had been subjected to a policy, a law that they were not to share any of their seed. And there has been a very huge campaign to incorporate GMO production in our farming practices. So most of large farmers, which is a very big industry, is done by multi-million agencies. And so we do our crop farming in greenhouses, most of which is entirely on chemicals and agrochemicals and agro-processing. All these are handled by human beings. We have large farms that are flower farms in Naivasha, in Kajiado, in many parts of the country. And these farms are managed and administered by people, most of whom have ended up with communicable diseases, skin conditions, and other terminal illnesses, and therefore really putting at risk these laborers. So these labor laws, as it were, and collective bargaining agreements, they have not really worked for this hard-working Kenyans. They earn peanuts. They are not even adequately covered with the medical care. Medical cover in Kenya, I mean, is in the state that it's in. I don't want to go into details, but it's barely working for the not really the middle class, but the lower cadre persons. And so the little money they spend, they earn, really goes into catering for their basic needs, so much so that when they become ill, God forbid, they are not really able to take care of their medical health, and therefore being a very risky place to be. And so the labor laws, international labor laws that we have or are talking about, most of which have just ended up being on papers, because every other season you hear flower farms employees being on strike, agitating for more pay, and what they are given the employers. And so this, that we don't have these labor laws, we keep talking about them, but the implementation matrix is what has really lacked. So we should be able to work around to ensuring that all employees who works in flower farms, who work in those greenhouses, most of which is toxic with all manner of chemicals, really are protected. And I think most importantly, to work around adopting sustainable farming practices and agroecological practices, so that we're able to ensure that we don't have to subject the laborers in the farms to all these hazardous biological chemicals, to so to speak, that will put their lives at risk. And most importantly, I think it's an oversight we are having, that some of this biological weapon that has been fashioned against not of us who are laborers is even in the food. The chemicals input in the food and farm production is at the highest at this point in time. We haven't even the rearing of the animals as little as chicken in the chicken outlets, the many chicken, all those. We have chicken right now that are ready for eating in 3 weeks, in 21 days, in a month's time. All of that is chemicals that we are taking in through food and through other aspects of that we consume, that literally subjects all of us at risk. So food production in many aspects, I don't know about Uganda, but in Kenya is the highest, almost has the highest component of biological chemicals that would really put all of us at risk, and therefore being able to live, having terminal conditions, health challenges, both respiratory, skin diseases, and all other conditions. Therefore, we work so hard to earn all this money that we all end up spending in taking care of ourselves in terms of medical care. So that is my presentation and submission, so that even as we look about the labor laws and the injustice being meted on them, how about the food that we take? How safe and secure is it to ensure that we really are healthy going forward to serve our nations, to serve our communities and our counties, and to live a healthy and a long life? That's my submission and presentation. And so at TEAMEnvironment Kenya, we have been running a campaign on sustainable development goals. We shall be having a webinar, God willing, on Wednesday, during which we shall be able to give us adequate time. It will be running for 2 hours to have all these aspects really discussed and canvassed to greater lengths and heights. For that, I want to submit and say thank you so much.
Thank you so much.
Thank you so much.
I would like to, first of all, thank Dr. Awinda and Mr. Ochanda Mathew, because you were the key speakers. Unfortunately, I was handed over the moderation very late, because Dr. Abdulhu Byakatonda was far away. There was no network. So we started around 8:40 after he called me and took over the moderation. I was also just one of the speakers. My name, for those who have come late, my names are Dr. Oling Kerjew. I'm independent member of the Industrial Court of Uganda. I would like to welcome Brother Asa Wilson Owere, the Chief of Labor Affairs and External Labor Powerhouse, if he's there. Okay. Having heard what the other brothers have stated, I would like to make a comment regarding what we have just discussed. I think we have to think about what the ILO is doing in a way that help us to advance workers' protection against biological hazards in East Africa. I believe that safeguarding workers from biological hazards calls upon us to advocate for the ratification of ILO Convention number 192 and the recommendation recommendation number 209. It is important for us to make sure that we advocate for such biological hazards regulations in the convention to be ratified by our governments, because they pose a growing threat to workers in East Africa, especially in agriculture, healthcare, sanitation, and informal sectors. The new adopted ILO Convention number 192 and its recommendation number 209 offer a transformative framework to protect the workers and promote decent work. Therefore, we must advocate for urgent ratification and implementation, not only across Uganda, but in East Africa region and Africa as a whole. Biological hazards include not only exposure to viruses, but bacteria, fungi, parasites, and contaminated environments that we see not only in towns or villages, but everywhere around us in our countries today. These risks are prevalent in East Africa due to climate change, due to urbanization, and due to limited occupational health infrastructure in our countries. Furthermore, informal workers make more than 80% of the labor force in Uganda, especially vulnerable, and I believe in most of African countries, including East Africa, countries like Kenya, Tanzania, Rwanda, Burundi, etc. So the key provisions of the ILO standards have to be mandatory, because it will allow mandatory risk assessment and preventive measures. It will help employer responsibility for biosafety protocols and protective equipment to be provided by our institutions, and inclusion of informal and migrant workers in protection of frameworks, promotion of worker participation in hazard management. All of those things, we have to advocate for them to be adopted by our countries, if at all we desire to benefit from ILO conventions. The benefits of adoption will be the improved public health through reduced workplace disease transmission, enhanced productivity and economic resilience, formalization of informal work, expanding access to social protection, regional harmonization of labor standards under the East African Community. And these, we have to advocate for them to be made in a policy form, to be ratified, and to be integrated into provisions, not only into Ugandan labor laws, but also in laws of East Africa, as well as Africa in general. We have to advocate for the launch of awareness campaigns and training programs in Uganda and in East Africa and in Africa in general, and for the establishment of occupational health units in high-risk sectors, and collaboration with East African community partners for regional implementation and monitoring. And I now give opportunity to Dr. If he has something to say before we close Do we have Dr. Awinda Otieno, Danice?
Yes, I'm there. I'm there, doctor.
Yes. Yes.
Yes. So
I want you to give us the remaining wisdom that you did not have time to give us.
yes, thank you very much. I just want to reiterate on what my other colleagues have said, that it is true that the ILO recommendations, the Convention on Biological Hazards, is very key for our nations to be able to adopt. But one thing, the fact that these recommendations or these conventions have been adopted, have been aligned within the formal sector, you'll find that the informal sector remains left out, because here you have farmers working in agricultural farms. We have uh, we have the lower cadre workers who are not really protected. So as you said that we line all these conventions, we have them lined very much in the formal sector. The problem remains with the informal sector. So I think that what we should do is that we should have our nations or our countries being able to adopt all these recommendations across, so that every person will feel that they are all in, because we're talking about areas like rural sectors, we're talking about other areas like agricultural farms. We talk about farmers dealing with the livestock, who are likely also to suffer from such diseases like zoonotic diseases. We have unsafe handling of waste. We talk about lack of PPE, personal protective gear or equipment, and these ones are very significant. That one we find across all our nations. So we need to have this our countries coming up to ensure that all the workers across on all cadres will always be protected. Similarly, if you look at other gaps which remain, we talk about resource allocation, we talk about worker education, very, very important. We talk about monitoring, especially in agriculture, in informal sector, trade sectors. We have serious problems that we need to ensure that these gaps are filled. So ILO has come up with very good recommendations on these hazards. But now the problem is implementation, the reinforcement of all these, so that workers feel protected against all the hazards that may be there. Because if you don't have that, I've said that if these workers are not protected, they feel unsafe in their workplaces, then they become unproductive. There will always be loss of morale within the workplace, and that one will also reduce the productivity. And by the end of the day, it cascades down or up to the whole economy of the country. So my parting shot is that let us have our nation, let us have our countries across East Africa, across Africa, and the whole world embracing all these the ILO's recommendations, the conventions that are going to help the workers against these biological risks or biological hazards. Otherwise, I think that's what I had to add. Thank you very much.
You're welcome.
My name is Dr. Danice Awinda. I teach at Kabarak University, Kenya. I'm a researcher, environmental studies. Occupational health and safety is my area. Thank you very much.
You're most welcome. If we have any brother and sister who want to contribute, you're most welcome. Purity?
Yes, I want to say something.
You're welcome.
Yeah, this is Agatha.
Okay.
I just want to say something about these conventions. Yes, these are set international standards that member countries of the UN have, of ILO, need to follow. And since they have had an input through their representatives. But what we need to do is to, as the community, as workers ourselves, is to make sure that we lobby our governments to ratify these conventions. Once these conventions are ratified, they can be incorporated into our laws. So that comes to the domestication of the standards, so that all these standards are included in our laws. So once they are there, then we can be able to, as a country, to benefit from them, and also make sure that we observe all the set standards. So on a parting note, that is what we need to do on our side. That is the work we have to do, especially now that we know the benefits of having this convention. It's a very, very core convention. So let's go out there and lobby our leaders, our parliamentarians, to make sure that this convention is ratified, and later also the parts that are there added into our laws. Thank you.
You are most welcome. Do we have any brother or sister who want to contribute? Okay, I have something I want to say about how hazards affect workers in East Africa. First and foremost, we have physical and psychological risk. Workers in mining, in agriculture, in construction and manufacturing face very high exposure to physical hazards such as machinery accidents, toxic chemicals, and poor ventilation. Since I began to work as independent member of the Industrial Court of Uganda, I have realized that we have certain injuries that are not within the jurisdiction of the Industrial Court of Uganda to handle. It includes certain types of injuries that are not even allowed for the judges of the Industrial Court to handle. So if we are going to talk about hazards, how hazards affect workers in East Africa, we also have to think about all kinds of hazards, including also psychological hazards such as long hours, job insecurity in workplaces, and workplace harassment. Most of these things can lead to stress, burnout, and mental health issues. We also have very weak worker protection. Many workers operate in very informal sectors, not only in Uganda, but in East Africa, in Africa, and in many other countries around the world. So the informal sectors, I believe, have to be one of our obligations to advocate for our governments around Africa, East Africa, and the world to not only ratify these conventions and leave them in documents, but to advocate for those to be implemented not only in papers, but in our labor laws, in our courts, and to cover informal sectors to protect workers in informal sectors. Because many workers operating in informal sectors have little or no access to protective gears. They do not have health care insurance. They do not have even legal recourses, and they cannot even afford to follow up on any legal issues affecting them because there is no system put in place to protect them. We have also limited enforcement of occupational safety law means, meaning that employers often neglect safety standards, and the informal workers and also even workers who are working in industries find themselves exposed to what we are now discussing, that our governments have to not only ratify them, but implement them practically. The impact on decent work: hazards contribute to low job satisfaction, absenteeism, and high turnover. Injuries and illnesses reduce income and productivity, undermining the goal of decent work for all. So the excellent solutions for our countries, for East Africa, for Africa, and the rest of the world is to help our countries to strengthen the legal frameworks so that governments enforce existing labor laws and update them to reflect the modern risks that have been stipulated in the convention we are discussing tonight. Also to introduce mandatory safety audits and penalties for non-compliance with what has been ratified in our laws. We also need our governments to expand occupational health services, to invest in mobile health clinics and workplace health screenings, especially in rural and informal sectors, and to train more occupational health professionals to serve high-risk industries, and to promote education and training, to launch awareness campaigns on workplace safety and rights, and to provide technical training for safe equipment handling and emergency response. Furthermore, I believe that supporting workers' representation, not only like we have in the tripartite system of our court and our labor system, it has to trickle down to the informal sector, not only in Uganda, in East Africa, in Africa, but everywhere around the world. And I believe it is also the obligations of advanced nations to help poor countries implement these at the lowest level of the grassroots, to encourage trade unions, not only in the capital cities, but also at the grassroots level, so that the trade unions and worker committees advocate for safer conditions of the informal workers, to include workers in policy making and hazard assessments, because they are the ones who are working and they are the ones who know exactly what they are facing. And we need also to leverage technology and use digital platforms to report hazards, to track compliance and deliver training, and to introduce wearable safety devices in high-risk jobs. Many nations that are advanced in technology like Japan, even China, have already reached this level, but we have not yet implemented such a thing in our country. We also need regional collaboration opportunities. For example, East African countries can share best practices through regional bodies like the East African Community. We have to join initiatives, including cross-border safety standards, data sharing, and regional training centers. And I pray that we who have sacrificed our time to discuss these things become advocates to promote all of these things that we are discussing and to advocate for our governments to implement them. I pray that we have someone to wind up our conversation for tonight.
Yes, Dr. Oling, thank you so much. I want to really thank you so much for standing in for Dr. Abdulhu while he was held up, to really have coordinated the webinar well, and your presentation is on point. Like I said, we have been having an online campaign or an awareness creation on the Sustainable Development Goals, and what you are talking about is anchored on several SDGs, but this particular one is on SDG number 8, which is decent work and economic growth. Like the productivity of any laborer, casual or otherwise, is dependent ideally on their health condition. That's to mean what safety protective measures do we have on them physically or otherwise to ensure that we maximize on their productivity, may it be physical or casual labor or even professional work. And so with incentives or mechanisms or the working environment, if it's good, psychologically, socially, morally, their productivity definitely will be harnessed. Unfortunately, we find ourselves in these low cadre working people have been used as a political tool. Like in this past year, for instance, in Kenya, during the labor Labor Day celebrations, there really was nothing given or promised. But you will wait to see as we approach the electioneering period. We will have the monies that they were not able to be legally added as their part of their pack of their sharing or their health cover or whatever, NSSF, NHIF, all those earnings that they need to get to help them now, they'll be thrown to them during the electioneering period. It's a very sad and unfortunate situation. So we take the predicaments of our populace, our labor force, as a political tool. And so the point that I'm emphasizing is that we other than ratifying the labor laws, as it were, we need the political goodwill to really have them implemented, because a motivated labor force will be a much more productive labor force, will be much more resilient in many ways. Then we'll be able to have economic growth of our countries. We'll be able to have households, these individuals being able to uplift their living standards, as it were. And so it is a very, very important discussion we need to take to the next level, not just by good presentations, but we going out there and be the agents of change. We can even have ourselves, like we thank God for Dr. Abdulhu, who is a parliamentarian. So in the August House in Uganda and in Oga House in Kenya, and some of us representing here, when we get to those leadership positions, can we work around influencing policies? We can be employed as CECs at the county levels or at the national levels. So let us not just sit back to watch bad things happening. Let us be the voice of reason in our dispensation. Let's agitate for that which, because that laborer that is being suppressed by bad policies, the ripple effect of it will hit on me, who is the middle class or seemingly a high class person. So I have insurance cover, I can be treated wherever I want, but this person is a relative. And when they start fundraising, they'll come to Dr. Abdulhu, who seemingly has the money, or Ochanda, or all of us. So let us just over and above the great conversations, let's be out there to ensure that this word really gets to the people that matter. So as I finish TEAMEnvironment Kenya, we shall be having a conference coming up on 23rd and 24th at the International USIU, United States International University. And these are some of the things that we shall be discussing. We are reaching out to ambassadors, high commissioners, our ministers to really, and while they'll be there, we'll be able to have them answer to these questions. But other than the 23rd and on the 25th of October, we shall be having a conversation with children, because these are the generation that is coming after us, to have them also be part and parcel of these conversations, for them to understand their rights, their roles, and their responsibilities going forward. So we'll be more than glad to engage all of us on our different social media platforms. Just check out for TEAMEnvironment Kenya and be able to join the conversations going forward. So with that, I want to submit and really reiterate my appreciation to Dr. Awinda for the great sharing, the great presentation of Dr. Oling, and all of us that have sacrificed their time to be part of these conversations. Thank you so much. We're really looking forward to having many more of this. Definitely, everything has a challenge, just like technology, it serves us very well, but there are moments when you don't have internet, it's tripping, and all that, but we are able to manage. We need to ensure that we're on schedule to do, really have been able to do. But like I've said, for the main speakers, it will be important you don't limit them to 4 minutes or 3 minutes or 5 minutes, because it's very, very, people have taken time to really prepare only to be given 5 minutes. And so I think that will be we improved on, but we really are grateful for such opportunities, because knowledge received is information, but knowledge shared is transformational. So what we seek is to ensure that we really transform our lives, livelihoods, and our communities through so much knowledge that we have and is harnessed amongst us. Thank you so much, and have a good night to you all. Bye.
Thank you so much. I apologize on behalf of the organizers. Due to time, we had to start very late. As I mentioned in the beginning, I was just one of the speakers. But then Dr. Abdulhu called me and told me that I have to moderate. And when we began, Dr. I think was also having, Dr. Awinda Otieno Danice was also having, I think, difficulties connecting. However, we have not, well, I thank Dr. Awinda Otieno Danice, the lecturer and researcher at Kabarak University, Kenya. And I thank Brother Asa Wilson and Mr. Ochanda Mathew and all the people who have attended and those who have been listening. I thank all of you for sacrificing your time. And I pray that those who have been organizing this meeting will continue to do that. And God bless all of you. I pray we meet next time again and have a good night. Thank you.
Thank you. Good night.
Thank you. Good night. I've shared my
Thank
contacts on the chat. Dr. Oling, kindly reach out. We'll be glad to engage with you.
Okay, thank you.
God bless you all and good night.
God bless all of you.